Hello everyone, this is Dr. Saurabh, surgery resident, JR2. Uh, at present we are here at RIMS Ranchi, and in this video we are going to explain you about surgery residency in India, which is not less than a commando training. And in this video we are very fortunate to have Dr. Vineet Mahajan sir, who is head of the Department of Cardiothoracic Vascular Surgery, RIMS Ranchi. Hi sir.
Hi.
So just I am making this video and trying to acknowledge all the people over India about the hectic residency of surgery,
Yeah.
and for that purpose we are making this short video, sir.
So this video which we are going to release in coming 1 hour is for the purpose of showing it to Pan Africa, just to give the idea how the surgical residency programs are there in our country, which are quite heavy and very hectic schedules. And the training of a surgical resident is not less than a defense personnel training, and one has to develop a good attitude, because surgery itself is not only reading and getting the degree. One has to be very physically fit to practice the surgical specialty. So we will let you know what should be a behavior of a surgical resident. It is very important to have a surgical attitude. Apart from reading the books and getting the knowledge of operation and reading only the books and understanding the subject, apart from that, one should have a good surgical attitude. Means, a surgeon should not go for a breakfast, lunch or dinner like the routine people are doing, because his training is like that. He should be ready to work for hours together, days together, without any food, water and sleep. This is how the training is that. So it is recommended to keep some biscuits, some fruit in his pocket or in his bag all the time, and whenever he is having a time. So whatever food he is taking is not given to him as a privilege. It is only, he is getting it by chance. So whenever he is having a time in between the cases or in between his free time, he can go to canteen or ask someone to deliver the food and take whatever. The timing of the food, the way other people in the life take food with the morning, afternoon and dinner, that is not for the surgical resident. He should train his body, because a surgery can go for 5 hours, 10 hours. That may be a breakfast time or a lunch time or a dinner time. So until and unless your stomach is trained to remain hungry without any food and water for long time, only you can practice the branch and can accept the challenges of surgery. Apart from this, I will show you what other attitude a surgical resident should have.
In
Okay.
few minutes we will let you know how the normal routine of surgery resident here in RIMS Ranchi, which is followed from past 10 to 20 years, because this is the only referral hospital of our state. Because apart from this medical college, we have total 4 medical colleges in Jharkhand, and from there also all the complicated case is being referred to us. Kindly join us.
I just want to introduce that India is a very huge country, and this is one of the state of the India which is having some 5-6 medical colleges in the peripheral, about 100-200 kilometers from this place. And this is the Apex Autonomous Institute, where all the referral of this state is coming. So it's a huge rush of people who are coming here in the form of trauma, sick disease, heart attacks, peritonitis, and so many issues are there. So it's a referral hospital, and the burden is so much, and the training is very high class, and lot of clinical material is here to learn here.
That we will let you know coming video.
Knowledge, I think there is one day for the casualty, that is 24 hour. That unit of that surgical specialty is having an emergency, and there are some 7 units which are covering all the 7 days of the week. And that unit
Here
will,
at present we have total 6 units.
six units. So they will be doing one emergency in a week, one major OT, one minor OT, and apart from that 2 days round and 1 day teaching program, and Sunday OPD, yeah, 1 day is OPD, and Sunday is usually a holiday, and that holiday is only for the
general people.
for the general,
Not for resident.
not for the resident. Yeah, true. That is only for the faculty and the
But faculty, but
consultants.
here faculty are also coming.
They are also
around
coming
on
for the
Sunday.
rounds, and these guys who are residents, they are having no holiday, including any any national holiday also. They have to come here, and they are working here 24/7. Okay.
So starting from 6 a.m. in the morning, the resident come, and at first
There is no time for the resident. The resident by definition is supposed to stay here for 24 hours. So if he is getting a chance to go out for some time, it is his luck. Otherwise, there is no duty for him, no time for him. He is supposed to stay here throughout the residency period of 3 years. And if he is getting some chance to go outside for some food or meeting some relative, it is his luck of that day. Otherwise,
this is
you
how
have to
the
stay.
surgery residency
This is
designed in India.
absolutely.
So that not only your
There is
knowledge enhanced,
nothing like a 5 or 7 hours duty. You have to work here continuously.
24/7.
Yeah.
But in emergency, you have to be there because maximum burden of the patients from various parts of Jharkhand, they are coming 24/7. Yeah.
True.
There you have to. There many emergency cases are coming, and at that time only you have to operate that patients, and we don't know how long that operation will go on.
Yeah, how
So,
long that will go, and
yeah.
you have to treat that patient that time only. Otherwise a precious life will be lost only. And emergency people are coming. There are certain people who are coming without any relatives, unknown people, unconscious people. So it is the duty of the resident to take care of everything, including sometimes you don't have relatives there to arrange for the blood also. So you guys only have to arrange the blood and investigation. Sometimes they come without money.
Here many times it happens that unknown patient
Unknown
come to
patients are
hospital,
coming, and sometimes
and
police guys are bringing the patient. So we don't
we
know
have
from.
to arrange everything, start from medicine to blood operation. We have to carry that patient to operation theater, and we have to look after everything.
This is the usual story throughout the country for all the surgical trainings. So that is why I was telling these people that surgical trainings are not like routine trainings of non-clinical or paraclinical subjects. These trainings are not less than a commando training where you should be on your toes all the time, and any disaster can happen anywhere. So where is the opportunity of getting a lunch, breakfast or dinner in that time? So if it is coming on your way, it is all right. Otherwise, just the life will keep on going. We will let you show other places in the hospital also. Come. So this is immediately after the emergency. So see, you can see here lot of patients are admitted, and it's very difficult to accommodate everyone on the beds, and already the beds are doubled only, and you can see these are all floor beds because we don't have any option to keep these patients, so they are all kept here.
The line will go on
Yeah, and it's quite a big line, and
for next 1 to 2 kilometers.
1 to 2 kilometers it goes like this only, and you can see on both the sides lot of surgical patients. And
The advantage here, what you will get is that you will get chance to operate many patients.
Yeah.
So there is lots of hands-on. This is the one of the best advantage that.
so
you will
apart
get
from
here.
the hands-on, it's very difficult to manage these patients on the floor, because to dress these patient dressing, and to give medicine, to deliver injection, IV line, it's very difficult to do
This
it.
is the reason why here resident has to work 24/7.
Yeah.
Because here there is there is no deficiency in caring of patient. We
Absolutely.
used to dress
So,
the patient
so
every day.
you can see the corridors like this, full of patients.
It will go on. It will go on.
It will go on. You can keep a walk like
There is
this
no
for
end.
I think half a kilometer.
Yeah.
And so a lot of patients will be here only, and so there is no way to accommodate all these people, and this is the only way, and they remain here depending upon the disease they are suffering from.
Being most populous country in the world, the government is also not able to satisfy everything, suffice everything.
Yeah, it's not possible. It's not possible to satisfy everything, because we are having less resources, less
Yeah.
manpower, but lot of misery is there in the life, and there is no way to treat it, and that is how the life is going on.
The purpose of showing the post-time patient is only to let other country know the surgical burden the India is having. So we need not only resident doctor, very enthusiastic resident doctor, so that they can work 24 into 7. And believe me, if you will work honestly these 3 years now, you are going to become a commando of surgery.
Absolutely, because the hands-on training will be too much here for everyone, so they can do, and the moment they finish their post-graduation, they get the degrees, they are almost ready to go and start practicing at their own. So this is the advantage of taking surgical branches in these type of places.
Yeah. First 1 to 2 weeks now, it will be very difficult for you to manage, but slowly you will get used to it, and slowly you will start enjoying the process.
Yeah, absolutely. One day, the first day, if you come here, you will feel disturbed to look what is going on, but later on, you will feel that I think this is the only way to treat it, and this is how the God is also helping, and this is how the life is. And to all of you who are listening and seeing this video, this whatever treatment is going on is absolutely free of cost, and not even a single penny is being given by the patient. This is the beauty of this whole treatment. Fine. So this is the casualty of our hospital, where a lot of patients are coming on daily basis and getting admitted, and they stay here for the first aid, and even if there is a emergency case that is fished out from this place, getting operated in the OT, and they ultimately go to the ward. So 24 hours this thing is going on, and doctors are working here day and night, and the training people are there who are running the whole show.
Working 24 into 7.
Yeah, and it is everything is because of the trainee people who are there, and they are doing very good work, and because of that the things are going on. So a lot of people are there who are getting treatment here, full of energy is there among the paramedical and the medicos here, and everyone is getting the treatment free of cost. And this raffle is from the whole of the state, and lot of people are coming here for the treatment.
So this is what our hospital look like, and we have shown you only 10 to 20% part of hospital, because it is very large hospital. It will take more than a day to cover whole of the hospital, and we have only shown you the surgical department. And this is the reason why the demand of Indian surgeon is very high all over the world, because they are trained in such a way na, they can stand for hour and hour for days and days, and they can continuously do the operation. This is the result of this 3-year very hectic and very commando type of surgery residency. So never believe and never think that this is the residency is curse. Rather, it is blessing that is going to make you not only a doctor but commando.
And I myself, as a faculty, as a professor and head of the department, is probably doing more work than the residents of this hospital. And I start my work in the morning at 6, and after that I never go home. I stay here 5 to 6 days, and Saturday, Sunday probably I am going home only. The reason is that I am living alone. I have to get my room cleaned and the house cleaned, and all the 6 days I am staying here only, taking care of my patients 24 hours, taking food here only. That is why I want to tell these all boys and girls who are coming and working with me for some time that don't learn anything, any surgical technique or any bookish knowledge from me. Learn an attitude from me. At this age, if I can work like this, like crazy, you guys, you should not hesitate working. You should stay in the hospital, do whatever you can do for the best of the patient. Don't go for lunch, dinner, breakfast for a 1 hour break and other things. So you have to develop your body in such a way that you can resist any sort of sleep or food or water for long time, so that all the challenges of surgery you can accept it. Apart from that, it is very important to be very honest in this profession. Honesty for your profession doesn't include how good you are. You should be very honest also. You should not demand any money from the patients, or you should not look, because this is not a time for you people to earn money. This is a time for you to learn the things and train your body in such a way. After that you will go to a practice of your life, and money is there for it, will automatically come to you. So never cheat a patient, neither ask for a unnecessary investigation. Don't write drugs which are not required. Don't favor some particular laboratory. don't give a prescription to a particular shop and try to do the justice. If something, you know, if it 100 rupee or some money will go from your pocket also, you give it.
And that our surgery residents they are doing.
They should do, because
The people who are coming with no very less money, na?
sometimes you
They are
have to
just,
pay from your own pocket, and sometimes, you
our
know,
pocket only we are
suddenly the patient dies or something happen, we pay the money from our own pocket and make them reach their home and other things. So that is why. So in other words, I have just given you a small brief you know, introduction of the surgical program, which is very good in our country, not only in this place, in all other you know, government hospitals, and even in corporate hospitals the things are like that. That is why our surgeons are getting lot of training and tough training. They will, and you see today America, the Indian surgeons are doing
And that's why
and
the
phenomenally good there.
Indian
you know.
surgeon are best surgeon.
Yeah. So
That's
Indian surgeon, if you are finding anywhere in America, UK or Canada, they are probably much more better, because they have gone through this phase of their life and they know how to sustain the pressure if the pressure is coming to them, you know, in a big way. So thank you very much. I think it's a good introduction to the department, and later on, with your help, we will show them more. Okay. Okay. All the
Have a
best.
good day.
Bye bye. Have a nice day.